We continue with gross anatomy, the skeletal system, and we're going to look at joints which are found in the human skeletal system. Now, we need to also understand what really are joints. Now, a joint is simply a point where two or more bones get to articulate or make contact. That is a joint. Now, joints can be classified in so many ways. You can classify them anatomically or physiologically. We know that anatomically, anatomy is a study of structures and physiology is a study of function. So, anatomically, we can classify bones depending on the connective tissue that they have. That's a structure. Physiologically, we can classify them according to their movement. That's a function. How much are they able to move? Now, physiologically, depending on the movement, we can classify them as either being synostosis, which is mostly fibrous, amphiarthrosis, which is mostly cartilaginous, and diarthrosis, which is mostly synovial. But basically, we can classify them as being synostosis, amphiarthrosis, and diarthrosis. That is physiologically based on their movement. Anatomically, based on the kind of connective tissue they have, we can classify them as fibrous, cartilaginous, or synovial. All right. So we are going to look at each one of them, starting with the physiological classification based on movements permitted. So based on movement permitted, we can have synostosis. Now, synostosis joint is a type of joint which allows no movement under normal circumstances. So they are going to include sutures, the joints which are found on our head. Right on our head, you are going to see that on the human head there are some lines which get to move like that. Those are called sutures. So those sutures, they cannot allow movement. We also have synchondrosis. Now, a synchondrosis is a cartilaginous joint where bones are joined together by hyaline cartilage. So that is another example of a synostosis. So these do not allow movement. They cannot allow movements at all. So mostly these uh, synchondrosis joints are going to be found on growth plate. So if you consider a bone, like a long bone basically, you are going to have what we call the growth plate here. So at this point, this is a point which allows the bones to grow. This is where we're going to find this type of joints. It's a cartilaginous joint. All right. Now we are saying a synostosis joint cannot allow movement, right? And then we've also mentioned that examples you can have sutures and the synchondrosis, which is a cartilaginous joint where bones are joined by hyaline cartilage. What is hyaline cartilage? Hyaline cartilage is a cartilage that lines your joints and caps the end of your bones. Like at the end of this bone, you are going to find a cartilage there. So the one at the end of your bone, sometimes also referred to as the articular cartilage, which is the hyaline cartilage at the end of bones like that. Well, we'll understand more about that, but basically this is what we need to know. So a synostosis joint cannot allow movement. The example, I've got sutures and also a synchondrosis. We also have the amphiarthrosis. Now, this joint is going to have limited mobility or it allows little movement, right? An example of this type of joint is the cartilaginous joint that unites the bodies of adjacent vertebrae. So, when you have got, let's say, cervical bone number one and cervical bone number two, the joint that is going to connect these two bones, that is what we call a symphysis. A symphysis is a joint that is connect different vertebrae. That is an example of amphiarthrosis. It allows a little movement. So that is why you need to remember that what we said, mostly synarthrosis joints are fibrous, whereas amphiarthrosis joints are mostly cartilaginous, right? You can see that they are agreeing here as we are getting to discuss this, right? So the type of joint found in the vertebrae that is called symphysis. We also have dianthrosis. Now, a dianthrosis is a joint that allows free movement, totally free movement, and they are mostly fibrous joints. All right, so examples of these are going to include the joint that is found at the elbow. You have got the joint found on the shoulder, the joints on the ankle. You know that you are able to move your shoulder, you can move your hand in any direction, right? So they can allow total movement. Okay. So this is the physiological classification. So these are what we are talking about. We have got the dianthrosis, which allows movement in any direction. For example, here you can see you are connecting. Let's say this is going to be the humerus, the bone on your hand, connecting to your shoulder. Okay, so movement can be allowed without limit. And then you have got amphiarthrosis, which is this one, which is here, this joint which is found here. Okay, and we said this joint which is found on the vertebrae, that is going to be called a symphysis. That is a type of amphiarthrosis, symphysis, found on the vertebrae column connecting two vertebral bones. We also have the synarthrosis, which allows no movement, the sutures on our head. Right. So this is according to their physiological classification. What of the anatomical classification of joints, depending with the kind or the type of cartilage that they have, right? So we are going to classify them as being fibrous, cartilaginous, really not the kind of cartilage that they have, but we said when you're talking about classification based on anatomically, you get to talk about tissue joining. So it can either be fibrous, cartilaginous, like that. So let's start with the fibrous one. So the fibrous ones here, bones are strongly united by fibrous tissue. So that is the kind of tissue that holds fibrous bonds, right? Held by fibrous tissue, and they allow little or no movement. So that is why we said fibrous joints. They mostly when you are classifying uh, synothrosis, you can mention fibrous. Okay, so they allow little or no movement here. Well, not always at all we can classify fibrous as being synothrosis, but all we need to know is fibrous joints are going to allow little or no movement, right? So examples that we can talk about, we have got sutures, we have got gomphosis, we also have sigmosis. So these all are types of fibrous joints which allow little or no movement. All right, little or no movement. So we said movements with joints which do not allow movements, those are going to be called, we said that is a synothrosis. So in this case, we can classify these types of fibrous joints as being synothrosis because they allow no movement. But if they allow little movement, then that is going to be classified as amphiarthrosis. Right. So sutures, a suture is a fibrous joint that joins the bones of the skull to each other, except the mandible. Okay, the mandible, the lower jaw, the joint there is not a suture. So these do not allow any movement. We have got also gomphosis. A gomphosis is a fibrous joint that anchors each tooth to its bony socket with the upper or lower jaw. Okay, so this joint we're able to see here is called the fibrous joint because why fibrous? Because we have got fibrous tissue, connective tissue there, right? So we also have a syndesmosis. A syndesmosis is defined as a strong membrane of ligaments. Okay, a strong membrane of ligaments. Right, so these are examples or classifications that we talked about. Syndesmosis, sutures, and gomphosis. Okay, now I don't have an example on syndesmosis here, but I can just mention something. Syndesmosis, we have got bones connected through fibrous membrane, right? As we've said, a strong fibrous membrane or ligament. So examples you can talk about is between ulna and radius, like these two bones, the ulna and the radius. Okay, you are going to have we can I think this is the one here, okay, which is a syndesmosis, of course. You have got the ulna and the radius, these two bones. You can see we have got these ligaments which are here. So these tissues are going to connect these two bones, forming that joint. Or you can see also here there's a connection between these two bones. So that such a connection or such a joint is called a syndesmosis. So in the case of the ulna and the radius, such a joint is going to be called an interosseous joint. This one you're able to see, interosseous joint. Now, of course, the ulna and the radius, they are not found on the leg. Those are found on the hand. But they are more the same with the fibula and the tibia. So that's why the joint is the same. Here, we are going to have the fibula and the tibia because this is on the leg. But on the hand same, the joint is going to be called the syndesmosis, and it's a fibrous joint. And that is going to be called an intraosseous uh, joint. Or there is an intraosseous membrane which connects those two bones, right? That is a syndesmosis. There is an intraosseous membrane. We need to take note of that. All right. So, based on their anatomical classification, the type of the type of connective tissue they have, we also have the cartilaginous joints. Now, these here bones are entirely joined by cartilage. That's why we call it cartilaginous. So the cartilage can either be hyaline cartilage or fibrocartilage. So they allow more movement than fibrous joints, but less movement than synovial joints. So because of this, you can see cartilaginous joints are mostly going to be classified as amphiarthrosis. Why amphiarthrosis? Because they can allow little movement, at least more than fibrous joints, which allow no movement. Right. So here we can have we can have first primary cartilaginous joint, which we call as a synchondrosis, or we can have secondary cartilaginous joint, which we call a symphysis. We also mentioned this earlier. Now, a primary cartilaginous joint, which or a synchondrosis is a cartilaginous joint where bones are joined together by hyaline cartilage, or where bones are united by hyaline cartilage. We need to take note of that. So in primary cartilaginous joint or synchondrosis, you need to have hyaline cartilage, and you can further classify them as either being permanent synchondrosis or temporal synchondrosis. The permanent synchondrosis does not ossify. To ossify is just the process of bone formation. So there is no ossification or there is no bone formation there. So as you get to grow, there is no growth of bones, or there is no formation of bones as you get to grow. Okay, for example, you have got a thoracic cage, such as the first sternocostal joint. The first rib is joined to the manubrium by its costal cartilage. So the rib is connected to the sternum. Okay, that's a sternocostal joint. So there, that's a permanent sarcoidrosis because there is no growth as you get to grow. We also have the temporal sarcoidrosis. So a temporal sarcoidrosis is simply an epiphyseal plate. So I mentioned this when you have got a bone, you have got these regions of a bone, the growth plates here. So this is what we call a temporal sarcoidrosis at the growth plate. So it allows the growing of bones there. So the kind of joint you have there is a cartilaginous joint, right? So you also have secondary cartilaginous joint, which is called a symphysis, which is joined now. A secondary is joined by fibrocartilage. Okay, fibrocartilage. Now, fibrocartilage is much stronger and less flexible, so they are considered mostly amphiarthrosis. Why? Because they allow little movement, meaning that they allow slight movement. All right. So this is how we're able to classify them. Those joints which are cartilaginous, either being primary or secondary. Primary further divided into permanent or temporal. Know that primary are joined. The kind of cartilage you find is hyaline. Secondary is fibrocartilage. Okay. And then if we can look at this diagram now, we have got the temporary sarcoidrosis. This is the one you're able to see here on the growth plate. On the growth plate here. So this is what gets to allow bones to grow. And then you have got the permanent sarcoidrosis, which is the bond or the joint found between the sternum and the ribs. That is permanent. There's no ossification, there's no growth. We also have symphysis. So this one we are mentioning here is a primary cartilaginous joint. And then the secondary cartilaginous joint, that is a symphysis. And this is an example we can see here of a symphysis. We have got a fibrocartilaginous joint, fibrocartilaginous cartilage there, the one on the that gets to connect these two bones here. This is of course the pubic bones. So the joint that gets to connect two pubic bones, that is a pubic symphysis, because we have got a fibrocartilaginous uh, cartilage there or joint. Apart from that, we also have the synovial joint. Now, the synovial joint is a type of joint that is found on bones that move against each other. Bones that move against each other, right? Like here you can have this bone here and another bone here. So they're going to be connected by a synovial joint. And this is going to be found like on the elbow, on the ankle. So we are going to find a synovial joint. So for the synovial joint, we need to know some different parts. Of course, you have got the muscle that is going to attach to the bones. You have got enthesis there. Okay, we are going to know that. We have got the epiphyseal bone. You know the epiphyseal, all right, we're going to understand more that. We have got the articular cartilage, we have got the ligament, we have got the tendon. We also have the bursa, the synovial cavity. So the cavity is just that opening inside. Okay, the bursa is this sac-like thing which is here. We have got the ligament, which is this one here, and then we have got the tendon, which is this connective tissue here. Okay, so the enthesis, which is at the end here, enthesis is the site of attachment of a tendon, ligament, fascia, capsule to a bone. So where a ligament, a tendon is going to attach to a bone, that is what we call an enthesis, just that point of attachment. Okay, the next one we have got the bursa. Now, a bursa is a small fluid-filled sac. This fluid-filled sac we're able to see in blue here. So it acts as a cushion between muscles and ligaments and bones, and allows the structures to glide and slide past one another with ease and with minimal friction. So in other words, the bursa is there to help the joint reduce friction, so that you are going to have what structures glide and slide past one another with minimal friction. Okay, so that's the function of the bursa. We also have the epiphysis. Now, epiphysis is a rounded end, this rounded end here. Okay, and this primary function is to form joints with the adjacent bone. That's the epiphysis there. Okay. We also have the tendon. Tendon is a fibrous connective tissue that attaches muscle to bone. So muscle to bone, you have got this muscle, you have got this bone. What is going to attach the muscle and the bone is a tendon. And then a ligament is a fibrous connective tissue that attaches a bone to another bone. So you can see just this thing that moves from one bone to another bone there. That's a tendon, I mean a ligament. And then you have got the synovial fluid. The synovial fluid, which is found in the synovial cavity here, is there to reduce friction between the articular cartilage of the synovial joint during movement. So it's just there to reduce friction. All right, so that is it on the synovial joint. Now, how do you get to classify synovial joints? So synovial joints are going to be classified into six different classifications. We're going to have a ball and socket. So the ball and socket, like the one which is found on the shoulder. So the ball and socket allows motion in all directions, and that is why it is referred to as multi-axial. You can turn your hand in any direction on the shoulder. So that is a synovial joint, multi-axial. We also have the hinge joint. Now, hinge joint allows motion only in one plane, like your elbow. You can't turn it more than 180 degrees. Okay, so only in one plane. So we call it uniaxial because it's only one plane. Uniaxial, right? For example, at your elbow. We also have what we call the saddle joint, which is a type of synovial joint. A saddle joint allows for all motion except rotation. So for the ball and socket, it's going to also allow rotation, but for the saddle, to allow motion in any direction, but there will be no rotation. Okay, there's no rotation. For example, the joint of the thumb, where the thumb gets to connect with these the couples there. Okay, so the thumb can be moved in any direction, but you can't rotate the thumb. Okay, that is a saddle joint. And so because it can move in any direction apart from rotation, we call it biaxial. Biaxial. We also have a plane or gliding joint, which is a part of a synovial joint. Plane or gliding joint. So this joint occurs when flat bones glide across one another. Example of such a joint is a joint that you are going to find on between the clavicle and scapula. Okay, so you have got a clavicle, this bone on top here, and then you have got this bone which is a scapula. So the joint that you're going to find when those are gliding on each other is going to be called a plane joint, and that one is uniaxial, meaning that it can only be allowed in one direction, like you can't go in all directions. Okay, so it allows motion on in one plane, on in one plane. That is a uh, a gliding joint or plane joint. We also have a pivot joint, which is a type of synovial joint. Now, a pivot joint is found, or let's say it allows rotation in it gets to allow rotation, like you can rotate. Okay, you can get to rotate. An example is a joint which allows us to shake our head when you want to say no. Okay, that shaking of the head, so it gets to allow some rotation. So you're able to turn your head this direction, up or down, like that. It is also a uniaxial joint, because in as much as you are able to do that, it is not that free. Okay, you are not, it is not that free. So the joint can allow you to go either up or down, but you can't turn your head around, like you can't move your end around like that, but you can go in the sides or up and down. So that is a pivot. Okay, a pivot. We also have an ellipsoid joint or a condyloid joint. Now, this one is similar to the ball and socket, but significant rotation is not allowed. For example, the wrist joint at the wrist, okay, at this point here. You can shake your wrist, you can move your wrist, okay, but the rotation is not much compared to here. You can move your hand up, down like that. Even here, you can do a bit of rotation, but the rotation is a bit of limited. Okay, the rotation is a bit of limited. So it is also biaxial because you can move almost in all directions, except rotation is going to be limited. So the only synovial type of joint that allows rotation in any direction is mouth, or mouth axial is the ball and socket. Well, this is all about joints. Thank you so much for watching. Stay blessed.